Everybody knows what they're going to say about themselves. And remember that the cheeky thing we're all going to do is we're all going to have a sentence that says, this was all my idea. It's going to sound very humble and conversational, but it's supposed to be funny because we're all going to do it. Okay, you guys get that?
My thought was that you guys want somebody else would go first and I'd go last and say, it wasn't my idea, but I haven't figured out how to turn off my microphone yet.
Welcome, everyone. This is your intro to the new Papers podcast. Linda, what does PAPERS stand for?
Some of you were loyal listeners to our previous podcast, the now defunct Key Line, Key Literature in Medical Education. We've moved on and we've moved up to PAPERS in partnership with the people from the Karolinska Institutet. PAPERS is our new podcast name. The acronym stands for Professionals and Academics Parsing Education Research, the PAPERS podcast. Now, Jason didn't know what parsing was. He wanted to call it perusing, but I sent him to the dictionary. In any case, join us and be part of our community, also known as the PAPERS people.
All right, so if you're going to be one of our PAPERS people, you need to know who we are. So maybe an intro to each of us. Lara, you want to go first?
Sure. Hi, everyone. My name is Lara Varpio. I am a PhD-trained research scientist working in health professions ed. I'm a professor in the Department of Pediatrics at the Perelman School of Medicine at the University of Pennsylvania, and I'm co-director of research in medical education at the Children's Hospital of Philadelphia. Really excited to have a chance to catch up with all of you again on this new PAPERS podcast that was totally my idea. Over to you, John.
Okay, we're probably going to fight about whose idea this is. But for everybody who's joining us, I'm Jonathan Sherbino. I'm an emergency physician at McMaster University. People sometimes think that I have the attention span much like a golden retriever chasing squirrels, which is probably apropos for my clinical work. I'm also the Assistant Dean for Health Professions Education Research. And so I have a day job and a night job, which means I don't sleep much, but I have a high affinity and a deep love affair with coffee. So we're arguing about the origins of where this podcast came from. And Lara, I know you're trying to take credit, but let's be honest, this was probably my idea. Linda, you agree with me, don't you?
Oh, I think we're going to have a little bit of an argument here. I'm Linda Snell. I am a consultant in general internal medicine at McGill University in Montreal in Canada. And as an internist, I add a little bit of thoughtfulness and gravitas to this podcast. I did, of course, actually come up with the idea for the podcast many years before you were even born, John. What do you say to that, Jason?
I have a lot to say to that. So first of all, my name is Jason Frank. I am a professor of emergency medicine at the University of Ottawa here in Canada's capital, where there's currently several feet of snow on the ground. I also work as a clinician at the Ottawa Hospital, and I'm currently the founding director of a Center for Medical Education here in the faculty. And really, this was all my idea because when I was 7, I dreamed of how I'd start a podcast about medical education, and these guys are just hangers-on. But, maybe we should talk about who PAPERS is for. How about you, Lara?
Sure. The PAPERS podcast is for all of you who work in health professions or medical education. So if you're an HPE educator or a teacher, if you're a researcher who works in the field keeping up with the latest research, if you are looking for some inside tips to be the one who has the best argument in the room when it comes to making different decisions in your educational programs, but more than anything, we're a global community of people who are interested and thinking about and worrying about health professions ed. Every week, we select a paper from the published literature, and somebody, one of the 4 of us, is going to give you a presentation of that paper, a little summary, and the rest of us will weigh in and correct the others on where they went wrong, because they will, unless it's me. At the end of the episode, then, we're going to end up with a round of voting. There is much debate about how absolutely useless this tool is, the level of that utility. Don't worry, again, it's not useful, but it's something that we adhere to because some people on the podcast are a little older. Oh, no, that's not you, Linda. I'm talking about the other 2 guys.
So I really like this idea of a community. We want to engage each other, but more importantly, we want to engage with you. We'd love to hear your ideas, where we went wrong or where you interpret the literature differently. We'd like to hear your questions, the questions you're wrestling with, because it's probably very much like the questions we're wrestling with. We'd like to hear your recommendations for things to consider or for ideas or themes to kind of pursue.
A big thanks to all the amazing health professions education leaders we've worked with for years to make training better. And also a big thanks to the people from the Kingdom of Sweden, as Jonas Nordqvist would say, from the Karolinska Institutet. We have Jonas Nordqvist, Maria Water, Teresa Sorrow, Samuel, our new producer, and the whole Karolinska Institutet crew, who were so welcoming to us in our new partnership. A big thanks to you, dear listener, for all you do at HPE. So join us, subscribe to the Papers podcast today.
We're looking forward to having this conversation again with you guys on a regular basis. So keep an ear out for the next episode, and we'll see you on the podcast. Talk to you later.
Thanks for listening. Take care, everybody.
Bye-bye. Simon, our new producer, and the whole Karolinska Institutet crew.
Samuel is our producer.
All right, stop,
Samuel.
Stop. Linda.
It says
Linda,
Simon
his name-
here.
Your name is
It does
Samuel.
say Simon. Simon, I'm sorry, but I read what was written. And I just
We're
like
really
what I
out of
said
practice,
earlier.
people.
So
We're
I'm going to
so
start
out of
this.
practice.
It's just a little prank on my part.
Right.